Tobacco cessation is a vital component of recovery enhancement. This presentation will talk about the dangers of tobacco use while undergoing life-preserving medical treatment at City of Hope. In City of Hope, we are here to help you stop any type of tobacco use. Continuous tobacco use causes harmful effects in any situation. It is especially harmful when undergoing treatment of any type of surgery, transplant, or treatment procedures. Therefore, when you are meeting your care team, please be sure to mention any past or present use of cigarettes, smokeless tobacco or vaping products. Your care team can refer you to the City of Hope C3I Tobacco Cessation Team. We can help connect you with resources which will help guide your path to achieve tobacco-free life. Tobacco use causes harm to the entire body and mind. Users of tobacco have an increased risk of cancer, heart disease, stroke, depression and anxiety. Though cancers in the head, neck, lung, bladder and kidney are most common, the risk of cancer anywhere in the body is higher in tobacco users. Causal links between tobacco use and diabetes, vision loss, stomach ulcers and reproductive problems have also been found. Because chemicals in tobacco can reduce the amount of oxygen in the bloodstream, thicken blood and narrow capillaries which supply oxygen to tissues, the ability of the body to heal after any type of surgery is reduced in tobacco users. Carbon monoxide is a particularly harmful chemical found in tobacco products and has a deleterious effect on healing. Because it blocks oxygen from binding to the hemoglobin molecule, which is designed to carry oxygen to every cell in the body, the effects of carbon monoxide can cause a cascade of complications stemming from the cardiovascular and respiratory systems to in-tissue sites. There are many benefits of stopping tobacco use. For example, it can decrease problems during surgery, transplant, and other treatment procedures. Stopping tobacco use can reduce risk of complications and side effects such as pneumonia, heart trouble or wound infections after the treatment procedures. It can help you get home sooner. It can help promote healing and quality of life after treatment procedures. It can improve efficacy of cancer and other disease treatments. It can help reduce risk of developing other long-term tobacco-related diseases such as COPD, cardiovascular disease, and recurrence of primary and secondary cancers. Some studies also found that stopping tobacco use can add an average of 6 to 8 years to your lifespan. For smokers, by quitting smoking, your body no longer absorbs the 7,000 and more highly toxic chemicals in every cigarette into the bloodstream. This benefit starts the moment you decide not to light up. Freeing the need for tobacco use is a step on the path to taking more control over your lives. By stopping tobacco use, you will regain your free time because you are not being consumed by the act of tobacco use and freedom to spend your financial resources on tobacco products. You will notice the food tasting better and the smell of fresher air every day. By stopping tobacco use, you will have more energy and a new sense of freedom and pride. Within 20 minutes, your blood pressure and heart rate will fall to more normal levels, allowing your body to feel calmer. Different parts of your body will start to heal. By 10 years, your risk of death from lung cancer will be decreased. Some people may have been thinking of tobacco cessation for a long time, and some people may try to stop on their own for several times. Stopping tobacco use can be difficult at times, but it is not impossible. Any time is the best time to stop tobacco use. Here are the 6 steps we recommend you start with. 1. Determine your reasons for quitting and make up your mind. Be confident that you can take action to quit. 2. You may set your quit date and make a plan. 3. Prepare yourself to overcome your tobacco use triggers and habits. 4. Be prepared to fight cravings by using appropriate quit aids, such as tobacco cessation medications. 5. Get rid of any tobacco use reminders to make things clean and fresh. 6. It is okay to seek and receive extra help and support you need to quit. Your healthcare provider can be a valuable resource as you are trying to stop tobacco use. Now you understand the harmful effects, the benefits, and the 6 steps to stop tobacco use. There are actions you can take when you are receiving any surgery or treatment procedure at City of Hope. First, Before receiving any surgery or treatment procedure, our care team will encourage you to commit to quit tobacco use for at least 4 to 8 weeks before your surgery or treatment. You may ask your surgeon, treatment providers, pre-anesthesia testing clinic, or transplant workup teams about tobacco cessation treatment options and/or to refer you to the City of Hope C3I tobacco treatment team for an in-person or telehealth consultation appointment. Please be prepared to use nicotine replacement therapy or cessation prescription, attend tobacco cessation support group, and make a quit plan. When you are in the hospital, ask your nurses or hospitalist for nicotine replacement therapy prescription, such as nicotine patches, during hospital stay and discharge. Remember to ask a referral order to C3I Tobacco Cessation Program, for an inpatient cessation counsel and/or an after-discharge cessation follow-up visit. After you are discharged from the hospital, ask your surgeon or treatment providers about cessation treatment options or to refer you to the City of Hope C3I tobacco treatment team for an in-person or telehealth consult visit. It is very important to continue using nicotine replacement therapy or cessation prescription, attending tobacco cessation support group to stay quit, to prevent, and to address relapse. Tobacco is highly addictive and dangerous. A quit attempt requires timely, intense, frequent and multi-level interventions to properly address physical and mental changes. Our tobacco treatment specialists offer solutions and assistance with managing cravings, physical withdrawal symptoms, behavioral change, and guided support. By partnering with City of Hope C3I Tobacco Cessation Team, we can help increase your chance of success. Our program offers many tobacco cessation services including individual cessation counseling with education, resources and behavioral interventions, and tobacco cessation medications. We will partner with you to use rapid action plan to prevent and address relapses. Our tobacco treatment specialists will help navigate services to address disparities in tobacco cessation, find out if you are eligible for lung cancer screening and other healthcare access. We can help you to sign up state quit line and smoke-free text. The City of Hope C3I Tobacco Cessation Program also offer free, no-cost, tobacco cessation virtual support groups for any City of Hope or non-City of Hope patients and families. We are always here to help you stop any types of tobacco use. City of Hope tobacco cessation support groups are facilitated by tobacco treatment experts, specialists and ex-smokers. Participants who are committed to attend the support group are 6 times more likely to be tobacco-free 1 year later than those who quit on their own. Also, statistics have shown that up to 60% of tobacco users have quit by the end of the program. The C3I Tobacco Cessation support groups are in English and Spanish. You can attend the support groups virtually via Zoom or by phone at the schedules which is convenient for you. We encourage you to take an active part in your treatment, recovery and outcome by allowing the City of Hope C3I Tobacco Cessation Team the opportunity to help you quit tobacco use. Remember, any time is the best time for tobacco cessation. The C3I Tobacco Cessation Team can be reachable by phone and email at all times. It is never too late to stop tobacco use. The sooner you quit, and the longer you stay quit, the better your treatment outcome, and overall survival. Even if you have used tobacco most of your life, and are now facing significant health challenges due to tobacco use, further damage of your body can be prevented by starting to quit using tobacco today.